Hi, everyone. Thank you for joining us. We're just going to give it another minute as people enter the chat room. All right, we're going to go ahead and get started. Thank you for joining us again. Just a couple housekeeping items before I turn it over to Loree. This event is being recorded, so if you can't stay with us the whole time, or if you see something that you would love to share with a colleague or a friend, you'll get a link to the recording tomorrow. We really encourage questions, so if you hear something and you want to find out more along the way, use the chat box, and we'll have an open Q&A session towards the end of the program. If we don't get to your question, we will certainly follow up with you personally, and all viewer lines are muted. And I'm pleased to turn things over to Loree Jones, our CEO.
Thank you so much, Laura. Good afternoon, everybody. Welcome to the next in our series of Philabundance virtual town halls. We know we have many familiar faces or logins that are here. Thank you for joining us again. If you participated in the past, and welcome if you're participating for the first time. Allow me to take a moment and say that I started here as CEO in June and could not be more pleased to have joined a great team that before I started, responded to COVID in dramatic and I would say heroic ways, and we'll hear more about that today. But also started these virtual town halls as a way to make sure that we were communicating with and sharing information with our most trusted partners, and that's who all of you are. I would encourage you to look back, go to our website and view or share with your friends the other virtual town halls to get a sense of the work that we've done over the last year. And please plan to join us again next month and in the months to come for more information about what we do. We're hoping that our upcoming town halls will feature not just Philabundance folks, but as they have in the past, some of the partners that we work with. Laura mentioned we encourage you toward the end of this or throughout this to raise questions, send them in the chat or through Q&A, but also we welcome other suggestions and ideas. What else do you want to know and better understand about the work that we do? How else could we help you understand the challenges that we're working to address and the people that we serve? So really, first, welcome. Thank you for being here. Thank you to Laura for organizing this. And thank you to my colleagues that are joining me on this panel. And hopefully we will all learn something and continue to strengthen our partnerships. So again, gratitude. Thank you so much for joining us for a discussion about one of the most defining issues of the pandemic, and that is food insecurity. Over the last year, as we became aware of what a coronavirus was, and as our cities and countries shut down, and as unemployment seemingly instantly skyrocketed, we were faced with a new reality. People in America are hungry. Now, of course, this was not at all new. The US Department of Agriculture defines food insecurity as a lack of consistent access to enough food for an active, healthy lifestyle. And hunger refers to a more personal physical sensation of discomfort, but food insecurity refers to that lack of available financial resources for food at the household level. Now, for years, of course, we've been here working at Philabundance, but for years, we've heard about food insecurity and knew that one in eight Americans were food insecure. In Philadelphia. That was 1 in 5. We knew that 1 in 8 Americans, 1 in 5 people in the Philadelphia area were hungry. We also knew, as we think about the weather we've had, that there were times when schools debated closing on snow days because they were worried about whether or not the kids would have a place to get meals. But it seemed that all of a sudden, the issue of food insecurity became that much more apparent. And I'm positing that was for 2 reasons. First, all of us had a harder time finding food. So in addition to the toilet paper crisis of last year, staples were more absent from grocery store shelves. And when they did appear, they cost more. And to learn more about food supply issues, tune in next month where we'll talk about that, but also visit our website because we did a great overview back in May of the food supply challenges that we as everyday individuals saw, even if we weren't food insecure. So one of the reasons I believe it became more apparent was because we all had a harder time finding food. The other is that lines were moved outside and into cars. So social distancing meant that for the first time, people had to line up on foot or in cars to get access to the food, making their plight more visible than ever. So in addition to the increased need for food, it was just more apparent to everyday folks. Food insecurity so pierced our consciousness over the last year that we frankly saw a dramatic increase in donations. From the Bezos gift of $100 million to Feeding America, the membership organization representing 200 organizations like ours, to individual gifts, our donor base more than doubled. You probably saw back in December, the Today Show featured, I think, several days of programming around food insecurity. Over the last year, you've seen celebrities and sports figures name either Feeding America or name Philabundance as their main charity. Our Feeding America CEO was even named by Time's 100, named one of Time's 100 most influential people in the world. And my counterpart in Pittsburgh was named that city's Citizen of the Year. And then, of course, and forgive me for burying the lead, we welcomed last month the new president here for King Day of Service. So both then President-elect Biden and then Vice President-elect Harris visited food banks to pack food for King Day of Service. And it was great to have now President Biden join us to pack 200 food boxes that went to agencies right here in Philadelphia and Delaware counties. So speaking of President Biden, I will tell you what I told him that day. I said to him, today you're helping us relieve hunger now, or provide food to the tens of thousands of people in our region who are making that choice each day from either pay their rent or to buy food. That's why the food boxes you're packing today are so important. They're important because we are struggling here to keep up with that increase, which is 60% here in our area, as well as 60% across the country of people who are food insecure. And 40% of them are facing this plight for the first time. What that means in terms of numbers, that means that what was 635,000 people in 2018, still way too many, jumped to 890,000 people under COVID. So I said to President Biden, and yes, to Dr. Biden, today you're helping us relieve hunger now. But I said, hopefully and suggestively, the next time you come, I'd like to talk to you about what we are doing to end hunger for good. And so today, you're going to get to hear about both sides of our work. And I hope that we leave you with, you'll hear both about the feeding the line or relieving hunger now, as well as the shortening the line. Now, today, I hope we leave you with this. I hope you leave with an understanding of how Philabundance responded to COVID, a deep appreciation for the huge effort we made to meet that increasing need, an understanding that increased need isn't going away anytime soon, and related to that, and related to you all as our insiders and closest friends, a sense of how much more funding we're going to need to grow our infrastructure to sustain this for the next couple of years. Now, by infrastructure, I mean supporting our agency networks, providing more storage for dry goods and refrigerated food, as well as just ensuring that they have the capacity to continue to grow. I hope you also leave with, frankly, a desire to do more than just listen today. And I know we have many doers in the listening and tuning in. We're hoping that you will help share what you've learned with your neighbors, with your network, with your family. And as my Director of Government Affairs would insist, with your legislators. And so what you see now on the screen is the framework or organizational structure to understand how we've organized our work. And you'll hear both from Melanie Cataldi, who heads up the Ending Hunger for Now work, and you'll hear from her in a moment. But first, I'm going to turn this over to Stacey Behm, who heads up our Relieve Hunger Now work and who has been with us for 6 years, in the last 2 working in this operations role, and is probably the person most responsible for Philabundance's COVID-19 response. And so with that, I'll turn it over to Stacey.
Thank you, Loree. So you can see from that chart, the areas that I'm responsible for in my role as a Chief Programs Officer have everything to do with the food moving in and out of our organization. So the food sourcing, the warehousing, transportation, and then our network of agencies across the 9 counties that we serve. Next slide, please. And so we, when the pandemic struck about a year ago, I can't believe we're coming up on the 1-year anniversary. It seems like 10 years ago. We immediately focused on safety, recognizing that there were lines at grocery stores, that the lines at our agencies were increasing, that we had staff that were very concerned about their safety, we made some organizational changes to ensure that we were honoring social distancing and mitigating risk. So we immediately reduced the number of volunteers that came into our space. However, they continue to come. It's been amazing. Our volunteer force has been steadfast in their support of us, and we're ever thankful. But we did cut back on the number of volunteers that we allowed into our space. We reconfigured our warehouse area where we let volunteers in to ensure social distancing, face mask required, sanitation stations set up. We increased the sanitation that we did in our buildings, and we continue to do that as well. Wiping down handles and doorways and surfaces every 2 hours, for example, is something that we're still doing, as well as some deep cleaning on the weekends when no one's in the warehouse. We screen our volunteers, we screen anyone that comes into the building, we minimize people that are allowed in our buildings, and we immediately reverted to a work from home model. And so we had never done that before. And fortunately, we found out it works for us. We didn't know with our technology. We didn't know if everyone who needed laptops had laptops, but fortunately we were able to make that shift pretty seamlessly from a technology standpoint, and have been able to support our employees who are working from home really well. So we continue to do the work. What we saw across our agency network is that they were struggling under the weight of COVID. And in fact, right out of the gate, of our 350 agencies, about 70 shuttered their doors. And a lot of our network consists of agencies that range from pantries in a basement church, to a library where food's distributed from, to more of a social service agency that provides a variety of services. And a lot of the smaller agencies, those pantries at the local church or community center, they tend to be run by volunteers and people who may be medically vulnerable. So that we did see an impact, and they closed immediately. Most of them have since reopened. We provided masks to our agencies, gloves, sanitizing lotion. We shifted our operational model to also encourage social distancing. So where previously most of our agencies were offering what we call a choice model, and that means an individual who shows up for food could shop their racks and choose what they wanted to go home with. While not ideal, it was more safe to move to more of a box model. So we started providing boxes of, you would say, meal provisions. So it would be spaghetti and the sauce. It would be pancakes and the syrup. So things that families could use to make meals. However, they didn't have a choice because we had to prepackage it to make it safe to distribute at a distance. So that was a significant shift that the whole network had to make. We supported our agencies by providing volunteers, asking if they needed more volunteers, what type of help did they need. We started investing in their infrastructure. So if they said they needed a refrigerator so that they could store perishable food that we were providing, we got them a refrigerator. So we were very fortunate that we were able to do that last year because we received tremendous financial support from the community, individuals like yourself who saw the lines and saw the need and responded. And so we purchased refrigeration and other equipment for over 30 agencies in the calendar year 2020. And we are now in the midst of distributing to 80 more agencies, whether they said they need a van, they need a refrigerator, a freezer, a hand cart, a portable tent, any kind of equipment that they say that they need that helps them distribute more food and to do it safely. We are in the midst of providing that to them, again, and thanks to the donors who are supporting our work. So big emphasis on safety and how do we ensure that everyone can keep working. We made some really other interesting shifts internally where we put people into new roles temporarily. We had staff who worked in one department, moved to another department. We created ad hoc working group teams so that we could do things like different types of distributions that we had never done or hadn't done in a long time. Can you shift to the next slide, please? Which I think may just be a picture. Nope, that's the numbers. Okay, I'm going to touch on that in a moment. We did some distributions around that were outdoors that we at Citizens Bank Park, we actually distributed to a trunk to trunk model where we would put boxes of food into the trunk of the vehicles that came that day. We ran that for about 5 weeks, and that was in partnership with the city of Philadelphia as well as the Phillies and Citizen Bank. And there was a picture on one of Loree's slides of that distribution. We also had the support of the National Guard. So it was really a community-wide effort, and we served about 700 cars, households per 5 of the 5 distributions. And we were able to give them dairy and a mix of produce and some dry goods for their family for the week. So we did distributions like that were atypical for us. We also were involved with the city to prop up 2 distributions a week for the duration of the summer. So for about 5 months, we were providing produce to 40 different sites on Mondays and Thursdays, and that was a very valued additional way that we were supplementing the food that was already getting out into the community. A lot of this was possible because of not only the financial support we were receiving, but also the government support. And so on this slide that you're looking at, you can see comparing 2 different time frames, how our source of food shifted. And so in our FY19 timeframe, compared to the same time frame, October to August of our most recent fiscal year, last year, you can see how much more government food we received compared to what we typically got in donated food. So we did see donations drop. There were challenges in the supply chain. We all know that. Loree alluded to that, not only for us personally when we would go to the grocery store, but we were feeling the effects of the supply chain kinks at the food bank. And it ranged from our typical sources where we would get smaller donations, say from a restaurant or a catered event, that we weren't seeing those donations anymore. So it ranged from that level to our huge Grocers Against Hunger program, where the grocery stores were also feeling the pinch in the supply chain. And so the food that they had was being purchased very quickly. And so the donations from our retail partners decreased. So we saw some of that. However, we also saw things like restaurants, particularly larger ones that had a freezer full of food and they had to shut down, would turn to us and say, hey, can you use these frozen meals? Can you use this frozen chicken? And so we were able to take advantage of opportunities like that. It was a very unfortunate situation, but at least we could help get food out into the community. The government really stepped up with their the USDA program, Farmers to Families Food Box program. And that started last spring, and I want to say it was April, maybe early May. And it ran through the end of December. There was a very brief hiatus, and now we are participating in it again. And that is intended to run through April. And if funding is, if more funding comes through. Right now we are funded for February and March. And that's really the government is supporting not only getting food out into the community for those who need it, but also supporting our farmers who are also feeling the pinch of COVID and the effect on the economy. So it's been wonderful food, and we were able to distribute about 11 million pounds of the government food last year. And it's been a very desirable product as well for individuals who are receiving it. And we learned, one of the things in terms of food sourcing, we learned that we didn't necessarily have all of the skill or connections that we needed to buy food and source it in a creative way when there were all of these constraints in the supply chain with increased demand and less supply, production facilities that had to close temporarily because of COVID, not putting food out, like all of these things that were happening that were affecting the global supply chain. We found that we were kind of small beans in the purchasing world, if you will. And it makes sense. We had a purchasing budget prior to COVID of $1.5 million. And we've really used that judiciously just to supplement where maybe donations weren't coming in or some government food we expected didn't come in. We would purchase to fill in those gaps. Well, here we found ourselves in 2020 in a flip situation where the donations, we knew they were suppressed and government was coming through, but donors were coming, like financial donors were coming through. And so we had the ability spend more on food to make up for the decreased donations. And so in addition to being able to build a purchasing strategy, we were able to hire an experienced buyer to come in and really help execute on that strategy. And we have exponentially increased the amount of food we're able to buy this year. We went from $1.5 million to about $10 million this year. And we may spend more if we need to. We're already seeing the cost per pound of food going up. Produce is becoming more expensive. Dry food is becoming more expensive. And I'm not going to go into the weeds, I promise you, but it is truly things like cans are harder to come by. Cardboard boxes have become more expensive. So all of the behaviors that we've adopted and we see in the world, like online shopping, is literally affecting the price of food that we're able to buy. Transportation is more expensive because I think Amazon has all the trucks and drivers on the road. So we're having to respond to that, and we will most likely end up spending even more money on food just to ensure we can meet the increased need. So let me make sure I hit on some of the key points I wanted you to understand about how we shifted our operations and how we've responded to COVID. I didn't even mention, but we just generally we communicate more broadly and more often with our network of agencies across the 9 counties. We communicate differently internally in our organization. We use technology like Microsoft Teams to increase our productivity and communicate in real time across 3 different buildings and across multiple departments. So we're just very much focused on how do we operate more efficiently, how do we scale what we're doing? And not only for today, but looking ahead, we fully anticipate the tail on this economic recovery is 2, 3, 4 years out. So even if we personally start to experience a turn, we know that the people in line are going to be in line for a number of years before they're able to get out. And so that's really the Relieve Hunger Now pillar, the work that we do to get food out into the community today. And Melanie will talk about the other part of our work and how we're trying to shorten the line. So while we continue to feed the line over here, we are doing it in conjunction with trying to get people out of line. So now I will turn it over to Melanie to talk about that work.
Thanks, Stace. That is the perfect lead in. So I'm really struck whenever we talk about these numbers, around 1 in 5 people being hungry, or pre-pandemic over 600,000 in our 9 counties being food insecure, not necessarily knowing where their next meal is coming from, or having to make trade-offs between food and something else like medicine or rent, just to make sure that families eat. I think now more than ever, we are seeing the effects of intergenerational poverty and how fragile our system is. You know, I heard a saying the other day, a quote that I thought was brilliant. It is that systems are designed perfectly, absolutely perfectly, to get exactly the results that they get. And when you think about it, it's brilliant, isn't it? When you think about it, what that says is, even pre-pandemic, what we're facing, the challenges that our communities are facing, who are living in poverty and everything that's associated with that, are because of the system that is set up. And unless we start taking a look systemically and changing how we work together systemically, our communities are going to be in the exact same place 10, 20, 30, 50 years from now. And we don't want that. And so we also know that not only wealth is generated across moves across generations, but health also moves across generations. And when somebody said that to me at first, I thought, well, of course, genetics, you know, you sometimes can inherit chronic disease from your parents or from your family. But really, both wealth and health are transmitted across generations through also material and psychosocial advantages. And that's really what I want to talk about, is how the systems are set up and how Philabundance is now starting to work differently within those systems. I think also, no matter kind of which side of the fence you fall on with your beliefs around political parties or anything like that, you have to all agree that changes need to be made, even if you look at the economic cost of what's happening in our communities today. So Feeding America says that of our 9 counties that Philabundance serves, pre-pandemic, this is before the 60% increase, we're something like 500,000 adults that need help with food. If we're able to take just 1%, 500,000 adults, so 1%, 5,000 adults, and make them food secure, just 5,000, that would save $87 million a year in medical costs, a year. So I think that we can all agree that changes need to be made. The question is, how do we do that? And going back to what Loree was saying, Philabundance actually reorganized in 2019 to expand our mission so that we would have not only the Relieving Hunger Now side, which is a big part of what we do, but also the Ending Hunger Forever side, ending hunger for good. And Ending Hunger for Good really has 2 arms. The first is our anchor program, and that's the Philabundance Community Kitchen. The Philabundance Community Kitchen, or PCK as we call it, at its root, at its very essence, is a culinary arts workforce development program where students and graduates also have the ability to make meals to help feed the community. But that makes it sound too simple. It's so much more than that. Our workforce development program works with adults who are 18 years or older. They do not need to have a high school or GED. They do need to be able to read and do math at about a 5th or 6th grade level. But that's because we are doing the Serve Safe Management certification as part of this course. And we do have partners that help with adult basic education if students need it. So we're helping to find a new path for adults that for a variety of reasons have had either no or a troubled workforce history and an inability to provide for themselves or their families. What does that look like? That looks like every kind of person that you could see standing next to you in line, well, 6 feet behind you at line in a grocery store or next to you on the street. You can't necessarily know who's going to need help with food or who needs help with a program like PCK. I will say that probably around 60% of the folks that we enroll are returning citizens. So those that have some sort of criminal past and may have been in prison, but that is no reason to keep them out of the program. In fact, we welcome returning citizens into our program. We do a criminal background check, but really that's just so that we can help folks so that we know what we're dealing with and we can help folks learn how to talk about their history and the changes that they're making to change their lives. So at the end of the day, PCK really, we say it's a workforce development culinary arts program, but it's a life change program. And it has been so successful. We graduate around 67% of our students, and we have about an 80% job placement rate, 75% at 1 year and 73% at 2 years are still employed. And so that's an important point. We're not just training, but we're helping to employ. We're not just employing, but we're following for a minimum of 2 years to make sure that folks have the services that they need to either get reemployed or stay employed. And those outcomes are so tremendous. Our staff have really found what we call the secret sauce, that in August of this year, we were able to open up a brand new facility, which is what you see in front of you. This is a rendering, but it looks very similar to what we have. It's a 20,000 square foot facility that's at 10th and Dolphin-ish, if you know North Philadelphia. It's up by Temple University. And the building is amazing. It is basically split into thirds. So a third of it is workforce development with a job training kitchen and a state-of-the-art classroom. A third of it is a commissary kitchen, which can make millions of meals a year for the community. And the best part is the middle space, which is a completely flexible community space that holds up to about 150 people. So think community meetings, community meals, agency meetings, fundraisers. That space can be anything that the community wants and that we want to do with all of our partners. So what does this new facility allow us to do? Well, right off the bat, I'll tell you that without it, we would probably not be operating during the pandemic. Prior to this, we were located in a very small kitchen with a very small classroom in a nearby women and children shelter. Because of the space in this new facility and the way we're able to space out either in the classroom or the community space, where we would normally take in about 40 people per class, we're able to take in 20, but we're able to take in 20 and keep socially distanced and operate safely. And so we are operating in person. We have had to do a little bit of mix with virtual when the numbers started to climb a little bit, but right now we're back down and operating in person. And what happens is that the students spend 8 weeks in the workforce development side, and then they go over to the commissary kitchen where they're really learning large food production, large meal production. So think productions for hospitals and schools and shelters. They're learning on state-of-the-art, large production equipment, which then also broadens the type of employment that we can help them get. And when at 8 weeks, the students go over to the other side, we call it crossing the street to the commissary kitchen, another class comes in behind them. And so because of that, we're able to double the amount of students and graduates that we'll have every year. We also, because of the state-of-the-art space that we've got, are going to be able to do other types of education and other types of partnerships. So I saw on our list today, I think we've got some of our partners on the phone. We're working with the Drexel Food Lab, for instance, and what Drexel is helping us do is really recipe development for healthy food that either isn't in the market now or is in the market, but we need to be able to make it a little bit healthier and also give the ability for folks to buy local and to support a program like this. So think of it as social enterprise. This building will allow us to have social enterprise partnerships to be able to find new ways for people and companies, food companies, to support us, and therefore also support the workforce development program at the same time. It also will allow us to do continuing education. We'd like to get into kind of small business entrepreneurship, continuing education, a sort of curriculum. I think there's a lot of things that we can offer to our graduates once they're out in the workforce that will be really helpful. All right, next slide. Oh, that's a lot of words. I'm not going to go through them all. This is the other arm of Ending Hunger for Good. So while PCK is our anchor program, the other side is working cross-sector with what we call the other social determinants of health. So PCK is actually an example of that. PCK is education and workforce development. But education and workforce development is just one of the other things that affects somebody's life, wealth, and health. So if you look at this list, we have food in the first column. We have economic stability, which has to do with employment, debt, income. We have the physical and built environment of a neighborhood, the housing, the safety, the transportation. We have social integration and community engagement, and then we have the actual healthcare system. And the thing is that all of these, including food, intertwine together to make up somebody's health and wealth. So you can't really just solve one silo here. We have to work together to create a safety net where these services, including food from Philabundance, are working together. So think about, and in fact, like the slide says, you think about genetics and that they could affect your health. But the things that you see before you here, the things that are not passed down genetically, but may be passed down generationally, affect 70% of your overall health outcomes, 70%. So if you've ever heard the saying, your zip code shouldn't determine how long you live, this is what it's talking about. Where you live often really does estimate what your lifespan will be. Next slide, please. So then there's the cycle, because not only are they interwoven, but they actually affect each other and create a cycle. An example here is with food insecurity. So if you think about somebody who doesn't have the resources to feed themselves or their family, many of these families are the same families that have a higher incidence of chronic disease. So we have a family who can't afford all the nutritious food, either all the food they need, all the culturally appropriate or nutritious food that they need. They're often also dealing with chronic disease, heart disease, diabetes, and then they've got the stress of not having the resources. They may have housing instability. The stress then causes them to worsen the chronic disease while they're making trade-offs between food and rent and medicine, which worsens the chronic disease, which worsens the stress, and pretty soon you have a cycle going. So again, if we just deal with food alone, we're not breaking the cycle. Does that mean that we don't start with food? Of course not. So I should say that as much as Ending Hunger for Good is Philabundance working differently, it's also starting with us working the exact same way. And that is getting food into the household, getting food into the community, because we can't deal with all the other things if somebody's hungry today. So the Ending Hunger for Good work actually always starts with Relieve Hunger Now. Next slide, please. A lot of words on this slide too. Basically what this is saying is that once we're getting food into the household or food into the community, we Philabundance also need to be working with housing, education, and that includes workforce development, financial literacy, and healthcare. And in essence, what we're trying to do in a collaboration is help move people, individuals, families up the stability ladder. So take it as, say, crisis to thriving. There are lots of stages in between, and a person or a family may identify it being in any one of these stages. But what we're trying to do with our partners is help move them up so that eventually they're thriving, and in our case, no longer need the emergency food system. Sounds easy, right? We're just going to all work together and everybody's going to become stable. We all know that that's not how it works. It does mean that we need to do things a little bit differently. Stacey talked a lot about us collaborating. Now we're forming additional new collaborations. So Habitat for Humanity and the Philadelphia Housing Authority, I think I saw is on the call today. We are working with entities that do coaching, so Episcopal Community Services. So while Philabundance is always the food, we are working together to determine kind of what the overall, what we call a theory of change looks like in neighborhoods. So if we choose a neighborhood and we start with community engagement and community assessment, and we understand really what are the barriers to not only food security, but real stability within a household in these neighborhoods. And then we determine with our partners, with the community, right, who is also a partner with the community voice, how can we help address, intervene, develop programs together that address the food insecurity and other challenges that folks are facing in a way that works for the community, and that we can have short, medium, and long-term outcomes that eventually show increasing stability for a person or a household. Sounds like a lot. It is a lot. What it also means is that we need to look at data differently. Right? So historically, where Philabundance has really looked at how much food do we get into a community, or how much food do we get into a household? What type of food do we get into a household? How many pounds are we distributing this year? That's great to know, but it doesn't necessarily tell us if we're helping somebody move up this ladder of stability. So now one of the things that we've done is we actually are implementing what's called a client level tracking system, where with our partners, we can actually track at the client level for folks that that opt into the programming, and see if we can actually track at that level where they're starting, what services they need, and if we can help them improve their stability over time. So it's really tracking different data for Philabundance, and it means sharing data with our partners across sector. So what does that mean for a program? What might a program look like? I'll give you a couple of examples. We have a fairly new partnership with a managed care organization. And this particular MCO realized that something like 40% of their members were identifying as being food insecure. And so they wanted to get food directly into the homes. And they came to us and they said, can you provide healthy, prepared frozen meals and fresh produce? And we said, yes, but we don't deliver directly to homes. That's, we have big trucks. That doesn't really work. And so we partnered with another partner of ours, Food Connect, who does delivery directly into homes. And with the partnership between Philabundance and the managed care organization and Food Connect and PCK, we're able to make meals. We have pre-boxed produce, and Food Connect is delivering that straight to the MCO's members who have identified as being food insecure. And not only that, but they are also able to send people who are looking for employment and training and are interested in culinary arts to PCK. So now you've got a partnership where we're addressing food insecurity at the household level and looking at health comes and looking at workforce development all together. That's one example. Another example is what we're calling place-based work. And that is where we choose a neighborhood based on data. So high unemployment, high food insecurity, high poverty, and somewhat lower transitory rate, meaning that families live there for a long time and want to continue to live there for a long time, so that we can work with people over the course of a year or 2 or 3 and help them increase in stability. And so in our place-based work, we're partnering with housing, with healthcare, with medical clinics, and coming together to do what we call that place-based theory of change, to see how we can help people move up that stability ladder. It's a lot. And I'll be honest, one of the challenges that we faced is that with the pandemic, everything took a backseat for just a little while because we were really all resources, all hands on deck, getting food out into the community. But we are now kind of starting to revamp this work. It is picking up momentum. I will tell you that there is no loss of appetite between the government and our partners and the communities for us to come together to do this type of holistic work. Whew, that's a lot. I think I'm gonna stop talking and we can turn it back to Loree and maybe answer some questions.
Yeah, that is a lot. Thank you so much, Melanie. I'll share with folks, I sent out an invitation to come to this to folks in my network, and I billed it as the Philabundance primer. And so I know that we have some new kind of faces or logins today, and you're likely learning for the first time about the complexity of our work. And thank you so much. And couldn't be more honored and pleased to get to work with Stacey and Melanie and the entire Philabundance staff, their teams, to do this work. That is in fact complex. We are trying to, as Melanie noted, really address and kind of rebuild systems that frankly haven't worked so well for folks. I want to highlight a couple of things. I know on the call, we also have a number of our board members. And so thank you so much. We couldn't do this work without really supportive board members who are pushing us to think strategically about this work. Thank you. I also believe on the call, we also have tuned in that other partners. We talked about it for the MCO work. So we talked about Food Connect, but also Health Partners Plans as a partner with ours in that work as well. But in closing, I did want to, I want to close out with a call to action and let you know other ways that you could get involved. And the main way, one of the main ways is through advocacy. So we talked about how we provide emergency food to people. We talked about the great work Melanie and the team are doing to really help transform lives and move people from crisis to thriving. We realize with the numbers of people that are food insecure in our area, in this 9-county region, we sometimes refer to it as Eagles country. When you look at the 4 counties in South Jersey and the 5 counties in southeastern Pennsylvania that we serve, we would not be able to meet this need solely alone. We realize that we need our partners, our agency partners that Stacey referred to. We need the kind of partnerships that Melanie talked about. But honestly, we also need the heft and breadth of government. And so we are always asking our friends and partners like all of you to help us advocate at that level, at the federal level, especially. So you've likely heard or seen calls for an increase in SNAP, and some of that has come through. That is the Supplemental Nutrition Assistance Program, what we used to know when I was younger as food stamps. We are always asking people to help advocate, call federal legislators, call the administration at the federal level. We believe that if we provide families with this particular resource, they would be able to choose the food that they're putting on the table for their families. And then frankly, also purchasing food in our neighborhoods, which we know has a positive economic development impact as well. So encourage you to join us and learn more about how to advocate. I believe that we're going to put in the chat a place that you can learn a little bit more about that through our partners at Feeding America. So join us in that work as well. And then also I wouldn't be doing my job as a chief executive officer of a nonprofit, and if I didn't thank you and encourage you to continue to support us in other ways as well. Stacey referenced the dramatic increases in what we've had to spend to purchase food. We know that food is costing, it's more expensive, donations are down, et cetera. And people have been, as I noted at the top of this, incredibly generous, but we're looking at making sure we have the resources we need to be able to provide a heightened level of support for, frankly, the foreseeable future. What reports are telling us that that's at least 2 years in terms of recovery. And so as you see kind of support coming through, know that we're trying to figure out what we can do most immediately for to support our folks, but also what we can also do over the next couple of years to support people. And then there are also kind of interesting other ways that people can support. Just you might see on the newsletter today, we've been partnering with 6ABC, with Garces Foundation. We're working on a project called Feed Our Restaurant Workers or Food Workers. You've also likely seen we've partnered with Toyota and others on a Little Abundance campaign, which is focused on providing funds to address childhood hunger. We're trying to think of a variety of ways to support these various programs that we're doing. So definitely visit our website, visit the Feeding America link that Laura provided in the chat. And also just let us know if there are other ways that you'd like to support our work, including volunteering. Laura, I'm going to turn it over to you because I think we have some questions that you're going to walk us through, and I definitely will encourage people to put questions in the chat or in the Q&A.
Absolutely. I will get started. This is a really good question. I'll direct this to you, Loree. Is Philabundance doing any collaboration with organizations like the Black Doctors Consortium or others who are doing COVID vaccinations?
Right. That's a great question, and I'll reference back. Stacey talked about how we started through COVID and how we are working every day to ensure that our staff, our volunteers, the people we serve, our agency partners are all safe. And clearly there's a new opportunity with the vaccine. So we have been working with and talking with folks at governments at various levels. So for our counties, it's been the state level, but also for the city where I'm presently sitting right now in Philadelphia to ensure that we have access to vaccines for primarily our frontline workers, as well as for our agency network. We believe as of this moment, we believe we're close to having that set up. So we're not directly working with the Black Doctors, but we're talking with other healthcare providers about providing the necessary vaccines for our staff. If you've read the news in the last couple of months or last several weeks, that's been challenging and definitely a complex issue. And we've been working every angle. Don't want to talk about vaccines without talking about the education piece of it too. So in addition to making vaccines available and easy for our agency partners and for our staff, especially the frontline staff, we're coupling that with education. We realize that it's important that people understand the safety and efficacy of the vaccine if they're going to be willing to take it. And that's something we definitely are encouraging people to do. So thanks for that question. When we are partnering with other healthcare entities to make sure folks get vaccinated.
Stacey, I'll ask you, with kids learning from home, learning virtually, they're not getting meals at school, how is Philabundance working to feed kids?
Sure. Thank you for the question. So we had to make a shift previous to COVID. We were providing, in addition to the students getting meals at school, Philabundance was working with several schools around the city on what we call Backpack. And that is a delivery of food that is it's in a bag, not literally in a backpack, but it's a variety of food that's intended for that, not just the student, but the household. And they would receive it on a Friday and could take it home. And it's food that was intended to last at least through the weekend, hopefully longer. So that's the backpack program. Once COVID struck and children were at home, we shifted our backpack program so that instead of doing the distribution through schools, that it was going to agencies in the communities where those schools were housed, so that they would still have access, but they would just have to go to a different location to get that food. We have been recently, I guess in the last couple of months, in conversation with the city about how we can help promote the school meals that are still available to families, but the families need to pick them up. So it's not ideal. It's not home delivery right now. So there are some challenges around getting that food to the families. It is still available to the families in need. Unfortunately, there's just been some, I guess it's logistical and resource challenges. I wish I had a better answer for that. But in addition to us shifting the way we distribute our backpack, we are, all eyes focused on just generally increasing the amount of food that we are getting out to all of the agencies that work with us, in the hopes that certainly is making its way into kids' hands.
Stacey, I have another question for you, actually, and this is a little difficult. Is there ever a time when we've had to turn people away for food?
It did happen early on in the pandemic when we and others who were sourcing food were really challenged, and before the government program kicked in, where we were really challenged by the supply chain challenges. And so, yes, there were times early on in the pandemic. We are not hearing that from our agency network anymore. And in fact, we are providing more food than we ever have to our agencies. And on an individual basis for each agency, they have access to more food. Like, not only do we have more food, but we used to have, in order to ensure the equitable distribution of our inventory, we would have what we call case limits on our food. And that was really just to ensure that enough, that we were distributing in equal amounts across the network, or it's prioritizing higher need areas if needed. Now, in addition to increasing the amount of food that we have available and continually ordering more food and ensuring we have more food, we have greatly increased those case limits. So any given agency can get much more food from us now.
Our next question is, how has your work been impacted with new thinking around culturally sensitive foods?
Could you repeat that? Your volume seemed to have gone down.
How has our work been impacted with new thinking around culturally sensitive foods?
Sure. So I'll start that. We are, because we have an increased food fund, if you will, the budget that we can spend on food, we're now turning to incorporate more culturally appropriate food. It is something that is not typically donated to us, so it's definitely more on the buying side. And so we are developing our plans around what type of food, like what are our community partners saying that the demand is for. So gathering that information right now, and we'll be providing more culturally appropriate food going forward.
And I'll add to that too, and glad for that question, and thanks for Stacey's answer. That's exactly right. You've heard us say a few times talk about our agency partners. We work through 350 agency partners across this region, and we really rely on them because they're connecting most directly to the people receiving the food to really drive this decision making. We're always looking for them to tell us kind of what folks on the ground are really looking for, and so we were pushing ourselves to make sure that we were providing more culturally appropriate foods. We've also done it on a smaller scale, but hoping to grow this through other partnerships. So we have partnered with the Horticultural Society through their community gardening program in Harvest 2020, which will likely become Harvest 2021, where individual gardeners are growing food. The food that's grown there tends to be more local, more culturally appropriate, and then that food is then donated to pantries as well. And so through that kind of program, as well as Stacey said, just purchasing what people are asking us for. And we've had agencies come to us. We've had agencies come to us that are serving Asian American populations in South Philadelphia. You've said, can you help us buy this? So we definitely are being responsive to that. So thank you for that question.
And this is a really good question as well. What is the area of greatest need in the short term?
Just one? So I think it's a tough question to answer. You know, hopefully you've gotten a sense of the scope of this challenge that we're trying to address, and really the complexity of it and the complex ways we're attempting to address it. And so it would be easy for us to say, if we just had more money, we could solve this problem. But we realize, and I go back again to what Melanie said, we're really trying to address the systematic issues. And so we are looking for partners who are helping us think strategically about how to address this and who are willing to partner with us in these more complex ways. And so if we were clearly, you know, through the slides and the information that Melanie shared, you have the sense of the complexity of the work that we're doing and what it means to develop a theory of change where you have multiple partners at a table, where we're also centering the people we serve, so that really what they want drives this process. There's nothing easy about that work. And that takes even more than funding. It takes time. It takes putting your ego aside. It takes really being willing to partner and collaborate and to think creatively. It takes a willingness to frankly try something, that if it doesn't work, to try it again and kind of fail forward. So there's that side of it. On the Relieve Hunger Now side of it, and Stacey gave you a sense of the complexity of that operation. So there, you know, everything from the logistics to, like, it matters if there were, you know, storms in California or fires in California, and that affects what we're seeing now, cans, hardboard, like kind of all of those complexities that we're dealing with is kind of really working through that. And so, you know, it's hard to put it in a word. I would say if folks want to, we prioritize collaboration here, and folks are, you know, I would say that one of the things we could definitely use and can always use is more partners and more folks that collaborate with us as we think through and work through these complex issues. And someone did also ask, I saw for the slides, we definitely make available, you'll have a clip of this that you'd be able to watch. We put it on the website, but we can share about, we should also be able to put the slides together to share as well. And we can put that in a follow-up message.
I don't think we have any more questions. So Loree, if you'd like to close, I'll give it back to you.
Yep, absolutely. I just want to again repeat what I've said before, and that is a message of appreciation. Thank you so much to all of you who've tuned in to learn more about what we do, our work, to offer suggestions and questions about how we can improve on it, how we can ensure that we're serving the people that we've made a commitment to serve that much better. So thank you for what you've already done there, and thank you to Stacey, Melanie, Laura for putting this together. Thank you, Stacey, Melanie, for your work, and to the entire Philabundance team, staff, volunteers, agency partners, board, for allowing us to do this work. So I leave you just with gratitude. Thank you all.